autoimmune disorders and fatigue rise globally, we need a metabolic revolution. Dr. Baker is an American orthopedic surgeon and a leading advocate of Carnivore Diet. He's authored the influential bestseller book, The Carnivore Diet.
We were operating on a lot of patients that struggle with obesity. Decided that we were going to try to help our patients to lose weight prior to taking them to the operating room. Many of them came back to me reporting that the symptoms in their knee had minimized dramatically or sometimes completely resolved. For every medical condition you can name, I think nutrition will impact that. I'll be the first one to say that it's not necessary for many people. There's a lot of people that struggle really with things like food addiction. Removing the carbohydrates from the diet can be beneficial. Meat is just extremely well absorbed in the small intestine. Probably 95% of what I consume is meat, and mostly red meat. I'm literally probably spending 20 minutes a day in total consuming food. It's doable, and you have to take ownership. You can't outsource your health to someone else.
Welcome to KhanKlinics, your dedicated space for exploring the vital connections that shape your well-being. Here we dive into everything from achieving peak physical fitness by mastering sustainable weight management to optimizing your diet for a vibrant life. We're passionate about uncovering the power interplay between your mental and physical health, offering you insightful strategies to nurture both. Join us as we unlock the secrets to embark on your self-confidence and your inspiration by interviewing top-rated personalities, not from only the US, but around the world. At KhanKlinics, our commitment is to bring you evidence-based information that inspires you to confidently control your health journey and live your life to the absolute fullness. I'm your host, Amir Khan. Let's get ready to unlock the true potential of being a human with the most amazing people around us. We live in a time where health is declining faster than ever. Despite more diets, more pills, more medical advice, we're still having issues defining diet. But what if true healing isn't about adding more complexity, but more about going back to basics? As obesity, diabetes, autoimmune disorders, and fatigue rise globally, we need more than just another diet trend. We need a metabolic revolution. In the middle of chaos, one voice is cutting through with clarity and results. Welcome to another enlightening episode of KhanKlinics. I'm your host, Dr. Amir Khan, and today we're diving into the most thought-provoking conversations in modern healthcare with Dr. Shawn Baker. From the operating room to the global stage, his bold advocacy for the carnivore diet sparks a health revolution. Dr. Baker, welcome to KhanKlinics.
Amir, my pleasure. Thanks for having me. It should be a fun discussion.
Dr. Baker is an American orthopedic surgeon and a leading advocate of Carnivore Diet. He's the CEO of Meat Treatment, MeatRx. He's authored the influential bestseller book, The Carnivore Diet, which serves as a comprehensive guide to his lifestyle. He's a world champion athlete, chief medical officer of Revero, which provides personalized care for metabolic and autoimmune conditions. Shawn earned his medical degree from Texas Tech University and completed his residency at the University of Texas at El Paso. Shawn, let's dive right into the first question and touch on what inspired you to go on to this journey and how did you become an advocate for the carnivore diet?
Yeah, well, first of all, it was about my own health to start with, as many physicians that come to this sort of discover. I was in my sort of early 40s and, my health wasn't where it should have been. Even though I was an athlete and physician, you think you would be immune from the effects of age and disease as a physician, which you're clearly not. So I started to heavily look into nutrition and started experimenting with several different strategies. And just coincidentally, at the time, as an orthopedic surgeon, we were operating on a lot of patients that struggle with obesity. And as you probably are aware, just like any other specialty, obesity complicates the results. There's higher rates of complications in obese patients when you perform surgery on them, higher risk for things like blood clots, infections, poor rehab potential and outcomes. And so as a community of surgeons, we had, together decided that we were going to try to help our patients to lose weight prior to taking them to the operating room. No real strategy was given. It was kind of left to our own devices to figure out how to get your patients to lose weight. And so at that time, I was doing a low carb diet myself, and I was advocating that for my patients. And not all the patients would do it. Some would. And interestingly, the ones that would change their diet to these very low carb diets, not often would they. I mean, it turned out that many of them came back to me reporting that the symptoms in their knee had minimized dramatically or sometimes completely resolved, even though I had them on the operating room scheduled for a knee replacement. So that was sort of intriguing to me. I was like, well, if your knee does not hurt, that's the primary indication for the surgery. So I can't justify an operation if you're no longer in pain. If you're willing to continue this lifestyle and this diet, then you can probably avoid or at least delay significantly your surgery. And so that was really the first spark that got me interested in this. I mean, certainly, you think about diet and weight loss and to some degree diabetes, but you're not thinking about it in terms of a lot of other conditions, which, as you probably are aware now, nutrition impacts dramatically. Mental health, as you talked about in your intro, arthritis, and from my perspective, things like rheumatoid arthritis, psoriatic arthritis, of course, osteoarthritis, a whole gamut of autoimmune diseases seem to respond to this. So this has got me interested in doing this. And so the more I delved into the fact that lifestyle had such a powerful impact, stuff that I didn't really learn in medical school. This was something that was sort of glossed over, wasn't really emphasized, and it certainly isn't incentivized in any significant way. In ways, it's kind of de-incentivized, to be honest. And so I was kind of a little frustrated with that. And so I, just kind of stepped away from, the clinical practice, which I had trained in. It was kind of a tough decision. But ultimately, I feel like I'm ultimately making a bigger difference for more patients in a more holistic way, which has really been life altering for these people in a very good way. And so that's what kind of led me to this. And I was in this low carb sort of environment, and I came across these people that were just consuming basically just meat, and I thought that was insane. I thought this just makes no sense. Fiber, vegetables, phytonutrients, vitamin C, all these things that were obviously things that would be on my mind and anyone else's mind. But as I delved into it further and further and saw the just tremendous potential as a therapy, that this really excited me. And so I've been pursuing this now for almost a decade now, just in my own personal life. And then as far as interacting now with thousands upon thousands of patients that have literally changed their lives, for the better. And I think it's a great intervention. It's a therapeutic tool. It's 3 months, 6 months for most people. Some people will do it a little bit longer. Some people will do it indefinitely, which I think is, and it's controversial, but I think there's certainly people that are examples of that. So it's an interesting thing because, and I don't necessarily want to call something a panacea, but I mean, the number of conditions, and I would just say nutrition in general, I would be so bold as to say that for every medical condition you can name, I think nutrition will impact that, either good or bad. And I think that, I mean, I've seen things that are like genetic disorders, things like Ehlers-Danlos syndrome, which is just, it's a genetic connective tissue disorder. People, they dislocate their joints spontaneously. They go on a diet and their joints stop dislocating, which still mystifies me as to why that works. I don't know why. I can't figure out mechanistically what's going on yet, but it just does. And I mean, fortunately, we're now seeing greater and greater interest in this. I mean, there's finally a little bit of funding to fund some studies. So we've got a few studies already that have been accomplished. We've got more in the works. And but as you mentioned, on the mental health side, which is a huge problem, here in the United States, it's something some estimates would say one out of every 4 people has some sort of mental health disorder. That's a lot of people, and diet clearly impacts that. I know that's almost controversial to say, but it really seems to.
Well, thank you for explaining that, Shawn. Just a follow-up question to the first question would be, do you miss your clinical practice? I know you're contributing tremendously on another forefront, and you picked that up. And, over a period of time, starts becoming a passion. But then medicine itself on its own is also, something that you trained. And do you miss it at all? Or how do you come across balancing the two? Or do you not now?
Yeah, I mean, as you know, there's good and bad. I mean, I miss the good parts, being in the operating room, working with a team, that was a lot of fun. I mean, I enjoyed that tremendously. There are a lot of sort of, parts that all physicians don't really much care for, all the paperwork, all the administrative stuff, which has kind of become increasingly burdensome. So I don't miss necessarily that. I like the fact that I have more autonomy now. I think more and more physicians have now have been captured by this sort of corporate takeover of medicine, to where independence is sort of kind of snuffed out in many ways. You're kind of restricted in a lot what you can do, and so I like I said, I miss the people. I miss some of the people. I miss some of the day-to-day interaction. Although I still get a lot of that. I still talk to patients on a regular basis. Sometimes it's in mass. So yeah, I miss parts of it. Other parts I'm fine not to do anymore.
So you drove yourself towards exploring the carnivorous world, and you came across the diet. You applied it on yourself. Tell us, what was the major message you would give to the audience? How is it different from keto diet, paleo diet, Mediterranean diet, and all of these other diets, and why choose the carnivore diet over all of the others?
Yeah, I'll be the first one to say that it's not necessary for many people. Many people can do fine with really any version of a whole food natural diet that excludes a lot of this ultra processed food that's so ubiquitous. However, I mean, some of the advantages we see, there's a lot of people that struggle really with things like food addiction. I mean, I think, we live in a society in which much of the food has literally been engineered by design intentionally to be addictive. Yeah. And a lot of people are addicted to it. So they have a real hard time moderating that type of food. And so when you tell people, hey, just, cut back on your calories, eat a little more whole foods, limit your processed food, that often doesn't work well for people. It's kind of analogous to taking an alcoholic and say, hey, just drink on the weekends, you'll be okay. It doesn't work well. So a lot of people need that level of structure and strictness so that it's very clear. The other thing is that from the standpoint of, certainly when we're looking at, say, glucose regulation, because a lot of people are diabetic or pre-diabetic, we see that across all populations now, removing the carbohydrates from the diet can be beneficial, and it certainly results in stable blood glucose. I see particularly with type 1 diabetics, we see a lot of those type 1s adopting this, and they have their insulin requirements fall down to very little. They end up with very well controlled, very great time and range on their glucose metrics. Also, it's interesting, many people don't realize this, but the human gut is uniquely and very efficiently designed to process and handle meat. I mean, we have this incredibly acidic stomach environment. The gastric pH is around 1.5, very similar to even scavenger animals like vultures and hyenas, are the animals that have an acid pH somewhat similar to us. And that's metabolically very expensive. It's very expensive energetically to produce all this hydrochloric acid in our stomach. It's not there by accident. It's there very much for a reason. So also, meat is just extremely well absorbed in the small intestine. There's very little requirement. We hear this so much about the microbiome and how important it is to balance your microbiome. And that is conditionally important when you're eating a lot of plant food, because this is where that goes into effect. You have this microbiome that largely resides in our large intestine, and it's there for the purpose. One of its purposes is to help break down things like fiber, which we're unable to break down ourselves. We don't have any of the cellulase, which would be required to break down the cellulose. And so because we don't need that, it doesn't matter really so much where our microbiome sits. This gets into a little bit of an interesting conversation, but it's just very efficient to consume meat, and it's a very steady source of energy. I mean, it's, we know all these new drugs out there, the GLP-1 receptor agonist drugs that are sweeping across medicine right now and showing a number of benefits across specialties. Really, meat does that very nicely. It has its own GLP-1 effect, but in a physiologically appropriate way, and rather than the massive doses that hang around. As you probably know, anybody that's on these drugs, that we're going to have a surgical procedure, they got to come off it they've got to be off the drug for 3 or 4 weeks because of the relative that slowing of the gastric area, because otherwise they end up with, as you know, aspiration pneumonia, which is a real problem. You probably treat some folks with that, I would imagine. But so there's some people, believe it or not, and I know this sounds crazy, that some people have sensitivities and they don't process fiber well, or certain fruits and vegetables actually are bothersome to them. And I know this is a really hard concept to believe, because we've been trained that, eating as many vegetables as possible and fruit would be the ultimate way to be healthy. But there are people that literally, these foods are problematic for them. Diabetics, particularly with very sugary fruits, they end up with unstable blood glucose. Some people with gut issues, particularly people with like inflammatory bowel disease. So you'd have Crohn's disease, ulcerative colitis. These people respond wonderfully well to restriction of fiber, removal of these various high fiber containing foods like fruits, vegetables, whole grains, and things like that. So it's definitely different than a ketogenic diet. I mean, there's no junk food on this diet. It is almost impossible to make a carnivorous product that is unhealthy, that's got all these, if you go on the shelves and look at vegan products or paleo products or ketogenic products, I mean, it's cookies and candy bars and cakes and junk food, and they just put a label on it. And it's, that's deceptive. It doesn't help people. I think it does just as much harm as some of the other, just standard junk food. So there's some definite differences. And I think the number of people, because this is one of the things one of the criticisms, it says you don't need to be this extreme. All you got to do is cut out the sugar and the junk food and you'll be fine. And yet I have people that do that already, and they've been doing it for years, and they still struggle with some autoimmune disease, gut disease. They remove everything, go carnivore for 3 or 4 months, and then everything gets better. So there's something going on here.
Thank you for explaining that. Shawn, tell us, what does your personal diet compose of when you're on a carnivore diet? Is it really strict meat only, and that's what you're approaching? Or do you additionally balance out, or do you add supplements, or how do you go about planning your diet? And then we'll go on to the other effects of the diet in general, metabolic, mental, and all that. We'll discuss that. But how do you balance out your diet? You work, you're an athlete, you were a world champion before, you've got a busy lifestyle. You want to make sure that your diet is supporting you and giving you all the nutrition and minusing away all the fatigue and stuff.
Yeah. So my personal diet, over the last, I've been doing this for about 9 years now. I consume quite a bit of meat. It's probably 95% of what I consume is meat, and mostly red meat, to be honest. Sometimes I'll have some fish. Sometimes I have some eggs. Occasionally I have some dairy products. And then every once in a great while, I'll have something that's, not at all carnivore, maybe a piece of fruit or something like that. But that's pretty unusual for me. I generally eat about twice a day because, again, the food that I consume is, one, it's incredibly satiating. Number two, it's very slowly digested and broken down. So I have this steady stream of energy throughout the day, which, again, it frees me up, gives me a lot of time because I'm not spending much time eating. I'm literally probably spending 20 minutes a day in total consuming food, which is, contrast to the average person who might consume 4, 5, 6, 7 meals a day, small meals and snacks a day. So food is very much, even though it's kind of interesting, food is a very important part of my life because I talk about it all the time. But in my daily life, it's a very small part because I'm only spending a minimal amount of time actually preparing, eating, and dealing with food. I don't really have much struggle planning with. Like, for instance, today I had a little bit of cottage cheese, and I had a couple steaks, and that will be probably the bulk of what I eat today. Just for reference, I'm 6'5", I'm 250 pounds, I'm a pretty big guy. I got, I went and ran some sprints over my lunch hour. This is so I stay active on a daily basis. And probably I'm consuming, if I had to guess, around 3,000 calories a day, which is not that much, given the size and the activity level that I have. And it's quite easy to plan, it's easy to stay on, and it's very much surprisingly keeps me full. This is the interesting thing about me. I've always been a really big person. When I was competing as a competitive power lifter, when I had some national records in that, it was not unusual for me to consume 7,000-8,000 calories a day, eating constantly and constantly being hungry. Now, and this is a thing that I found that when I first went on a low carb ketogenic diet, the first time in my life, I wasn't hungry. I had this weird sensation of like, I'm not actually hungry right now. And that was very freeing in itself. And this is one of the things a lot of people will say about, on the surface, a carnivore diet seems very restricted because you're not eating breads and pastas and fruits and vegetables and other, quote unquote, healthy foods or junk food. But at the end of the day, it becomes very liberating because you just don't want those things, which is something a lot of people can't wrap their mind around, saying, you know what, I don't really want the chocolate cake. I don't really want the bread. I don't want the pizza, the pasta. I'm very happy with what I have and I thoroughly enjoy my diet. It's something that I look forward to every meal. I never get disappointed. And all before I got to eat or eat something, the meal would be, I give it a C+, or, you're let down quite often. At least this is consistent at this point. I'm very good at making steaks at this point.
Right.
Having made thousands of them over the years, so I know how to cook for myself. So that's easy.
So it's mostly home cooked food. You hydrate with water and stuff. Obviously, it's there. And what about supplements and any other? Would you think that your carnivore diet requires you to get some additional supplements, or that's not something in your armory?
Well, I will tell you that from my perspective, the only supplement, and I sort of hesitate to call it a supplement, I guess I will, is I will consume electrolytes. I will add some electrolytes to my, primarily just because I work out and sweat quite a bit, so I lose a lot when I'm doing that. Additionally, particularly early on when people transition to the diet, we see a relative diuresis, natriuresis, sodium water loss because of the relative fall in insulin, which will have an impact on the kidneys, causing them to no longer retain as much fluid and sodium. So the electrolytes can be helpful in that phase to prevent things like headaches, dehydration, cramps, palpitations, and things like that some people will struggle with. And so beyond that, I don't really take any supplements. I know that, a lot of people commonly will still consume things like vitamin D, vitamin K2, a little bit of magnesium. Those seem to be commonly consumed. I'm not convinced they're necessary, but some people do seem to get a benefit from that. Now, again, I'm kind of the strange belief that food should be sufficient. I mean, humans existed throughout our existence without any significant supplementation, so it should be possible to consume a healthy diet without requiring all the supplementation, just like presumably every other animal species on the planet managed to do it. So I'm not a big supplement guy. I honestly think a lot of supplements may be kind of worthless. I mean, I do admit that there are some people that do better temporarily, and maybe it's a temporary deficiency they have to correct. And then once they get there, perhaps it becomes superfluous. But I'm not the guy that's going to be telling you that you have to take 15 different supplements to be successful.
One of the questions that were coming up about was that carnivore's diet is something that Dr. Khan has existed 4,000, 5,000, 2,000 or whatever years ago. And now we're in a different era. We're less mobile, less working. What would you advise? And I'm going to ask you the same question to those who are not as active. And does carnivore diet work for them? Isn't there an increased risk of high blood pressure and your blood becoming more thickened than other people, especially when we are sitting on our chairs for hours and hours? What's your advice for the metabolic side of things in general and people like these who have these sort of questions?
I think the fact that we have such a sedentary population is a problem irrespective of diet. I mean, I think we should all make an effort to, and I'm a big proponent of exercising and training hard, and I compete as an athlete, but I think the biggest sort of effect on health is just going from completely sedentary to moving a little bit. So I think about people, if I'm sitting, could I be standing? If I'm standing, could I be walking? That should be, irrespective of diet, that should be on everybody's sort of, to-do list. Now, with specifics to the diet, you mentioned hypertension. One of the things, as you probably know, most hypertension is considered idiopathic hypertension or essential hypertension. We don't really know. Sometimes we'll blame it on sodium consumption. One of the things I do see pretty commonly is people with hypertension, they go carnivore and their blood pressure normalized. Not everybody, but many do. And one of the thoughts is that, once again, as that effect I talked about, high insulin levels cause higher sodium retention, which leads to potentially higher pressures.
Sure.
And so I think that is going on. So as far as the thickening of the blood, I don't know that, maybe if you're hematocrits growing up, I don't think we see that too much. One of the big concerns, and we can touch on this is a topic unto itself, is, cholesterol, hypercholesterolemia, dyslipidemia that sometimes we do see in the context of all low carb diets. And so we can touch on that. But I think, my message would be, clean up your diet and be active. I mean, I just don't think being sedentary is necessarily an option. Now, what I will tell you is a lot of people are sedentary, not by choice, but by the fact that they are just in too much pain. A lot of people have back pain and knee pain and, ankle pain and foot pain, or low energy. And sometimes cleaning up the diet will relieve that. I see a lot of people whose knee hurts or their back hurts, they go carnivore and all of a sudden the pain goes away. Once the pain goes away, now they're able to start walking more, moving more. And then you get this sort of, instead of this vicious negative cycle, you get this virtuous positive cycle that occurs. And so I think that, in my opinion, all humans should be active. I don't think sedentary is a good condition for any of us. And I don't know that a carnivore diet is going to put you at any greater risk than any other diet is in that sedentary, with a sedentary lifestyle.
Thanks for explaining that, Shawn. Shawn, a follow-up question would be something on mental health. And generally, there is some myth around the carnivore diet, is that we're living in an era, again, where there is more anxiety, more depression. The roles that this diet was used several hundred or thousand years ago is now different. What would you say to the audience about mental health? Those who have mental health issue, is this that they need to be concerned about, or how can it make this better? Or does it have any role to play?
I think it definitely has a role to play. I think nutrition is a fundamental piece in the treatment of mental health. It may not be the only piece, but I think it is a critical piece. Right now, there is a whole bunch of literature that's come out, particularly on ketogenic diets, of which this would fall into that, in regards to treating things like anxiety, depression, bipolar disorder, schizophrenia, schizoaffective disorder. I've seen it impact PTSD. I've seen it help people with ADHD. I've seen even people with autism improve some of their symptoms. So I think that mental health is probably one of the more common things that I see treated. And I do think that in a way, we have to realize our brain is an organ just like any other organ in our body, our heart, our lungs, our liver, our kidneys, our skin. It's all impacted by our nutrition. Our brain is not sheltered. Even though there's a blood-brain barrier, still nutrition gets through and it impacts it. I see when people have very erratic energy supplies, that is, very labile glucose, that we see that often in their mood, their emotional lability is all over the place. And so a lot of people, what they notice is once they adjust to the diet and they have this more steady source of energy, their mood often evens out, and they have this sort of calm happiness. It's like they're just kind of more laid back, chilled out. And when bad things occur and stress occurs, and it will, that's part of life. We're always going to be confronted with troubles and problems. They're able to handle it better. They're able to just kind of roll with the punches a little better. So I think nutrition is incredibly critical. I mean, there was a study out of Stanford a few years ago looking at like serum carnitine levels, and carnitine is something that you obtain primarily from meat. It's that you really can't get that from plants to any significant degree. And patients with relatively low carnitine levels, now this is endogenously produced, we produce our own, but we can only produce a small amount. People that have low levels tend to have a much higher rate of major depressive disorder. And so when you bring the carnitine levels up, depression gets better. And I think there's a whole host of things, whether it's iron or zinc or even just inflammation. We have this, I mean, one of the common theoretical starting points for disease is a so-called inflamed gut, or gut hyperpermeability. Some people call it a leaky gut. That has some pretty significant correlations with a number of downstream effects, to include autoimmune disease. There's some great work out of Boston's Children's by a guy named Alesso Faisano, who's published a number of papers on this direct relationship between autoimmunity and gut health. And I think it holds up because I see it clinically. When you fix the gut, the autoimmune diseases go away. And I think it also impacts our brain as well. So I think it's multifactorial. I think nutrition probably plays several roles, probably many of them which we haven't been able to identify yet. But yeah, it's one of the most underappreciated and overlooked things. But fortunately, there is this whole emerging field called metabolic psychiatry, where people are starting to treat these psychiatric conditions and conduct studies looking at shifting your metabolic health in a more favorable direction. And to me, it's a shame that you see, if you go to any sort of inpatient psychiatric center, whether it's for acute care or maybe say things like drug and alcohol or rehab, they often feed the patients these horrible junk food diets, and it's just not beneficial for them. I mean, hospital food in general is probably substandard. If you go there and try to order at, they're getting all these sugary filled foods and then we're chasing it with a insulin sliding scale.
Yeah.
And it's just kind of like, it seems insane.
There is an athlete who wants to ask you specifically a question, and that's on his performance, and he wants to really know, if I'm on a carnivore diet, I feel like I need to take supplements. I need at times to boost my energy. And how do I just go about eating, get that boost of energy? Do I just go about eating more meat, more products along? And I'm just not a really good meat lover. So how do I?
Well, yeah, I mean, it's hard.
Yeah.
It's hard if you don't like the food, but just if you look at the physiology, I mean, what we're finding out is that it's less about muscle glycogen and more about actual blood glucose, which predicts drop-offs in performance. And so a couple tricks I'll tell you as someone who's competed as an athlete and been doing this very successfully as a carnivore. Some of the tricks I use is, one, as we know, hydrated muscles perform better. And as we talked about earlier, when you're on a low carb state, we often tend to be relatively dehydrated. And so often what I will do is I will consume a liter or more of water. Like this little water bottle I have here is 48 ounces. I fill it with water and electrolyte. I will drink that, in and around workouts, just so that I maintain good hydration within the muscles. The muscle fibers just fire better. They contract harder, and you perform better when you're well hydrated. So I will tell somebody, 30 minutes before you're going to work out, drink a bunch of liquid, add some electrolytes to it. The other thing is when I mentioned about blood glucose. So we know that when you consume carbohydrates, particularly simple carbohydrates, it's very rapidly absorbed. You get a pretty reliable, quick glucose increase, which will help your performance out. However, you will see somewhat of the same thing around meat. However, it's a much delayed response. And so if you were to wear a CGM, a continuous glucose monitor, and watch your glucose, half an hour, 2 hours after the meal, it's going to be pretty flat. But 3-4 hours later, you're going to start to see that gradual increase in glucose. And that's going to correspond with, there's this gastric residence time. There's a time that the food sits in your stomach before it breaks down and goes into your small intestine. It's around 3 to 4 hours for most people, depending on the size of the meal and the exact content of that. And so you'll see that glucose surge, relative surge, I guess, a couple hours later. So you might want to time your meals or your workouts and your meals to that way. Like, for instance, back in 2019, I won the World Championships in rowing. And I literally had a 3-pound steak 4 hours before I competed, because I knew that was going to give me the best chance to have the energy available to me when I needed it. And so you can play with the timing of the meals. You can make sure you're hydrated. Obviously, you've got to eat adequately. For those people that have to be on a carnivore diet for whatever medical reason, again, this is something that I, as a physician, I talk to people about, is there a therapeutic need for this? If there's not, then you can play with carbohydrates. You might want to find your minimum effective dose of carbohydrates. So instead of, consuming 300, 400, 500 grams the night before, you might find that, in the peri-workout time, maybe 10 grams is enough to get you just that little bit of a blood glucose bounce so that you perform at a better level. So those are some things you can play with or consider and experiment with and see how it treats you.
Well, thanks for explaining that. I have a follow-up, another question, which is similar to concerns about the meat, the source of meat. This one specifically is like, I live in a city. I'm concerned about inorganic products that have been added, artificial feeding, and meat and source. Could you ask Shawn, what would he suggest in terms of the meat products availability, and is there any specific type that he prefers over others, and his thoughts on this? the actual meat product
Yeah,
itself?
that's a great question. And this is a really good question, and I've asked this question of literally thousands of people on this diet because it's important to figure this out. I've had researchers like when Harvard did their study on this carnivore diet in 2021, they asked the exact same question. Do you have to have grass finished, organic meat, or can regular meat from the supermarket work? And the outcomes were equivalent. There was no real difference in clinical outcomes. Now, are there nutritional differences? Sure, there are some differences. But to be honest, there's differences depending on the breed of cattle, the age of the cattle, where it was raised, how it was finished, the sex of the cattle. All these things will play a role on there. So I mean, as much as I would like to say you should only eat organic meat and it has to be regeneratively raised because it's better for the environment, the reality is from a clinical standpoint, there doesn't seem to be a difference in outcomes that anyone has shown so far. And I have not seen it myself. Now, what I will tell people is, hey, if you can support a local rancher, that's better. It's just better for the system in general, because we are at risk of a lot of these things going away. And I know with your audience, a lot of people might be concerned about halal meat, and it's fine. I mean, that works just as well as any other type. I know, like my wife's family is from Algeria, and so they'll eat halal. And I go to Costco Business Center sells all this wonderful halal meat. If you guys are looking for some, it's a great place to get it. Sell it in bulk, and yeah, it's fine. So it doesn't really matter that much. I think the biggest thing is you have to enjoy it. You have to enjoy the taste, because any diet in which you don't enjoy what you eat, or if you're constantly hungry, you're going to fail. You've got to find a way to make what you're eating enjoyable. So that's probably really the biggest real concern that most people
Brilliant.
have.
Thank you for explaining that. That's fantastic. I know we're running out of time, and I love the conversation and how you're explaining it. There's a question that popped up. It was about, could you please ask him about what adjustments did he make, or is he making, or what would he suggest to people who are aging, especially after 50, and then going in their 60s, and those who are already in their mid 60s? How do they go about adjusting themselves when it comes to carnivore?
Well, that's a broad question for sure. I mean, I think that it's comprehensive. I think there's some general pillars towards health. I think getting good sleep is critically important. So you need to adopt good sleep hygiene habits. Amir, you probably deal with a lot of people with sleep apnea, I imagine, in your
Yeah.
specialty. So obviously, if you're carrying a lot of excess weight, that can help if you remove that. I think the diet is critical. I think there's another critical component. I think also being active to the degree that you can is important. I think our circadian biology is actually relevant as well. I mean, we are not nocturnal animals. We are daylight animals, and so I think we need to align our lifestyle, our sleep schedule, our eating schedule with the sun and sunset. And I think stress is another one. Stress is a huge component. I mean, most people don't realize, but stress contributes significantly to things like cardiovascular disease. Some people would estimate up to 30% of cardiovascular disease is brought upon by stress. And so having good stress mitigation strategies, whether it's, diaphragmatic breathing strategies, walking can be a great stress reliever. So those things are important. Now, specific to the diet, I think that, if I were to say what are the things that everyone should get rid of, and I think almost all of us would agree, the ultra processed junk food is doing no one any favors. There's no reason for us to consume it. I know, like we're in this time where we've got this Make America Healthy Again sort of movement. People are discussing what the new food guidelines should be. I will tell you, when I look at other countries' guidelines, I like Brazil's guidelines, quite honestly, because Brazil's food guidelines, what they say is limit or eliminate ultra processed foods, cook most of your meals at home, eat surrounded by people you love, don't fall prey to marketing. I mean, that is literally their guidelines. There's no like 7% saturated fat or 15 grams of added sugar. It's just, and I think if you adopt that, that's going to be a really helpful way to do it. I think that if you start prioritizing, if you think about why do we eat, what is the whole purpose of eating as a human being? It is to obtain essential amino acids, essential fats, source of energy, vitamins and minerals, and then arguably water. You get that very well in meat. I mean, we can debate about vitamin C and some of these other micronutrients, but I mean, the reality is you get what you need. And if you just make that the center of your plate and you start with the protein first and you fill up on that, you're going to find that you're going to want less of the other stuff. So if you put protein as a priority for every meal instead of sugar and dessert, because we've turned, a birthday cake into a 3 meal a day, 24 hours a day, 7 days a week celebration now. So we got to stop eating so much dessert. save that for those times that are really, truly special. Your birthday, not everybody's birthday. It's like the people say it's 5 o'clock somewhere, so they make an excuse to drink a beer. It's somebody's birthday somewhere, so you can make the excuse to eat the cupcake or the piece of cake. So yeah, starting out with, learning to love protein, I think is really incredible. I mean, I think we undereat protein dramatically across the board, and it leads us to basically have what some people call energy toxicity. We are so inundated with so much excess energy that we store in our body in the forms of body fat or liver glycogen that we just never get into a state where we can actually rebuild and repair our body correctly. And I think protein is a pretty good lever. I'm a big fan of protein. On a carnivore diet, obviously your fat level is going to come up because you have no carbohydrates, and so you got to figure out that mix. You can overconsume fat for sure. Don't let anybody tell you that fat is free and it's not going to make you fat, because you can overconsume it. Just like you can overconsume sugar and things like that. It's hard to overconsume protein. It's really hard to overconsume protein, and it's not very efficient. It has such a high, what's called thermic effect. So when you consume protein, about 20% of it just disappears into thin air in order to metabolize it. It turns into body heat. So anyway, those are some of the things I would look at. But I mean, again, and also as we get older, don't develop the older mindset. It is not normal to be arthritic and slow and overweight and hunched over and forgetful. That is pathology. That is not normal aging. We have to step away from that and realize that we should be high functioning, feeling good, not in pain for the entirety of our life. I think that is achievable, but you got to do the work. And, I think it's the little bit of time I spend every day eating well and exercising is a small sacrifice relative to the benefit it provides me for the rest of the time I'm doing
Brilliant.
things.
Well, thank you for explaining that. One final question, and that's going to come from a little bit from your book, from your book, and those for the newcomers who are coming to the carnivore diet. Give us a little overview about how can we make a safe and effective transition, and how can your book guide us through the process?
Yeah. Okay. So I would say, first of all, what I would say is, if you are someone that has a lot of comorbidities, if you're on somebody that's on numerous medications, I do think you need to get somebody that can help you transition, somebody with medical supervision. It's important. If you're a diabetic on a lot of, glucose lowering medications, if you're a hypertensive on a lot of blood pressure medicines, a lot of times as you improve your diet, you'll no longer need those medications. And if you continue to go on them, you'll have things like your blood pressure will go too low, or you'll get hypoglycemic, and those can result in real problems. So I think that's something we should state just from the beginning. So if you need to find a supportive physician. Now, hopefully there's some that are online that'll talk about it. I mean, our company Rivero has physicians in all 50 states, and that's what we do. We take people like that. Now, if that's not you, and you just want to, use my book or some other resource, and there are plenty of resources out there that talk about this. One thing I would say, just as a general rule, irrespective of your goal, maybe your goal is to get rid of an autoimmune condition. Maybe you have psoriasis you'd like to get rid of, or you've got depression you'd like to improve, or maybe just losing weight. I think the first thing you have to do is redefine your relationship with food. And so I tell people in the beginning, just focus on eating enough so that you don't want the other food. Now, that may or may not result in weight loss initially, but it gets you to a point where you have a little bit of a physiologic advantage, that you're not dealing with hunger all the time. And then you're in a better place to start to make those subtle adjustments that some people need to make. I tell people, people ask me, how much should I eat? I say, well, eat enough so that you don't want a cupcake, or you fill in the blank, whatever the junk food is that you normally cave to. That is a pretty good heuristic to live by. I think that if you're going to do it, I would say 3 months is probably a realistic trial. Most people, and I surveyed 12,000 people on this diet, and I asked them, at what point did you find that you got relief or significant relief? By 3 months, I think over 90% of the people had seen significant relief in whatever it might have been. Mental health issues, arthritis, gut issues, So 3 months is a good try. It's nice if you have some support. Again, when I survey data, people that had a supportive physician, supportive family, supportive friends were about 30% more likely to be successful. And I think that holds for probably any intervention we do. You want to have a good positive mindset. You want to eat enough so that you're not, having cravings. One of the biggest problems I see people do is they undereat. They go into this, I want to lose, 20 pounds. I'm going to intentionally shortchange myself, and then they're hungry, and then they're tired and fatigued and having cravings like crazy, and they say, well, I can't do it. Well, that's because you underate. You got to eat enough initially, and then make that slow transition. A lot of times it's funny. I mean, some people, the weight just falls off of them. They'll just drop, it'll be 3 months and they've dropped 50 pounds and like nothing. And other people struggle. And I see that particularly, unfortunately, with menopausal women. Menopausal women are a hard category to deal with, because they're dealing with the hormonal shifts, and it's just something that they struggle more. But I mean, I think the same rules apply in general. There's some slight differences between men and women, but as far as nutrition is concerned. But in general, consistent sleep, consistent activity, consistent diet, lifestyle, stress mitigation, sun exposure. I think all those things generally work for everyone.
Fantastic, brilliant. Shawn, one final message for our audience.
What I will tell you, particularly those suffering from some sort of chronic disease, one of the things that you're often confronted with when you get diagnosed with something, your doctor will say, well, you have this disease. And you ask the doctor, why do I have this? Very often the answer is, we don't know, bad luck, genes, something like that. And then you're asked, well, what do I do about it? And then they tell you, well, you just take these medicines, for the rest of your life. That is one, it's depressing, and two, it's very disempowering. And what I will tell you is you have a lot of power over the course of your life and over the course of your chronic disease. I see many people putting chronic disease into remission all the time. So it's doable, and you have to take ownership. You can't outsource your health to someone else. I can tell you, Dr. Khan, I'm sure, is a wonderful physician, but he cannot give the level of thoroughness. He doesn't live with it 24 hours a day. You live in the same body 24-hour a day, 7 days a week. As physicians, we get 15 minutes every 3 months. So we don't have as much skin in the game investment. So you have to take your health in the utmost seriously in your own hands. There's so much power that you have over what your outcome is going to be. So don't outsource it to anybody else. I mean, you can get support, and physicians can be wonderful at facilitating that. Hopefully the ones that actually do, a lot of them just don't have the skills or the resources or the time to do what's needed. And like I said, treat it like a full-time job initially, and it'll be worth it, because you'd be surprised what you can change in a matter of a few months to a year. I've seen some incredible transformations.
Dr. Baker, thank you for challenging the norms and obviously bringing about clarity to a very misunderstood area of nutrition, diet. We really appreciate and hope you keep this bold approach and focus. And obviously you're reshaping lives of many people through food, nutrition, and healing from chronic illnesses. We thank you for coming and explaining our audience all of these concepts. And a lot of people are going to go very happy with this.
Thank you for having me. I appreciate the opportunity. Hopefully it's been helpful.
Fantastic. What a remarkable journey we've just experienced together. The path to health isn't always straight, but it's always worth the effort. I hope today's conversation inspired you to take the next step in your wellness journey, armed with new knowledge and a fresh perspective. If today's episode left you inspired, share it with someone who need to hear this. Give us a thumbs up and your opinion. Keep exploring, keep evolving, and we'll see you in the next episode of KhanKlinics.